You're listening to the Stay Sore
What's up, guys?
podcast.
Welcome back to the Stay Sore podcast. I'm your host, Bo Skitsko, and today I have the pleasure to talking to Dr. Scott Haggerty. Do I say that right?
That is correct.
So we're talking to Dr. Scott Haggerty pretty much about this unit right here. And if you're listening and not watching, I'm going to explain to you what it is. It's laser treatment or low-level laser treatment. Does that sound right?
So there's different levels of laser therapy. So there is like your lower level or higher level class 3s, and there's class 4 lasers. So when you start transitioning into class 4s, they're considered to be more higher power lasers. So this laser here is the highest powered class 4 laser they allow therapeutically right now.
Okay.
So this is actually considered to be a high power class 4 laser.
Understood. So we're talking about laser therapy in terms of rehab, recovering from injuries, and just average treatment for the average person as well as athlete and stuff. Because there's many different lasers. There's lasers that read your CD music. There's lasers that can cut for surgery, and then there's lasers that can actually improve the healing process in the body. And really quick background, this whole thing is not new. Lasers are not new, right?
No, not at all.
So in the 1960s, a Hungarian physician started experimenting with lasers, and what happened was he tried to prove that lasers can treat cancer and tumors. And what he did is, on mice, he shaved the mice and tried to treat the tumor. And instead of getting the result from the tumor, he saw that the hairs would grow back really quick. So the recovery process was amazingly fast. And he started researching more and more. And then later on in the 1970s, it became kind of mainstream, and they did more and more research on lasers. So Dr. Scott, please tell me really quick, what's your background and why are we talking to you about lasers? How are you qualified?
So I am a doctor of chiropractic.
Okay.
I have a master's degree in sports science and rehabilitation. And so my background with laser therapy actually goes all the way back to when I was in chiropractic school. I went to a chiropractic college called Logan University out in St. Louis. And I actually went out there because my entire intent was to get my DC degree combined with my master's in sports science and rehab, because they had an incredible sports rehab program out there where we got to work with Division I athletes. We were out at University of Missouri. We worked with tons of local athletes. We worked with all different types of patient populations. So we would see first responders, police, fire, military, and we would see all kinds of different types of injuries. And one of the biggest things that appealed to me about laser when I first started learning about the science of it was its ability to go and speed the recovery process. You know, when people have injuries, one of the biggest issues they deal with is there is a dramatic loss of circulation when you have an injury. And so depending upon if the circulation can be restored properly, it can make it very difficult if the tissue doesn't have proper blood flow because of the injury for it to recover. And with a lot of chronic injuries, there tends to be a lot of these chronic issues with low blood flow, problems with the nerves becoming overly sensitized, and a lot of therapies have a difficult time being able to restore function. And when I saw laser in action, both on myself for some injuries I was dealing with, and injuries that I worked with a lot of my patients, it was amazing the pace at which they recovered, but also the types of things that it allowed me to care for that may not have necessarily been able to be adjusted. And we've seen in 9 years of doing laser here in our private practice, I've seen what I would literally constitute as miracles using laser therapy.
That sounds very promising. And one thing I love about your practice here, it's not just crack, everyone, which I think sometimes it's necessary to realign a person, but you also use a whole bunch of other techniques besides cracking, one of them being laser, some other, you have some really cool tools here, some science fiction looking stuff as well. So I like that you have a individual approach to everything, but today we're talking about lasers. So who could benefit from laser therapy?
Literally anybody with an injury. We use laser therapy to recover from, sprains, strains, tears, surgery. Personally right now I'm recovering from a wound. So we do wound recovery with it. We've had people that have had surgical issues where they get infections, and we help with driving the recovery process faster. Even when you think about things like post-surgical recovery, one of the biggest issues you deal with is there is oftentimes a time, right? It takes a long time to recover from a surgery. There can be quite a bit of pain. And there's a lot of adhesion formation. One of the interesting things about laser technology is they've actually found that when you laser over an area when you're recovering from a surgery, there's less adhesion formation. And adhesions can become a huge problem because scar tissue, when it starts to infiltrate the tissue, it can change the way the tissue functions, flexibility and pliability of the tissue. It can become a pain generator. So the less adhesion that a tissue forms post-surgically, the better the tissue will function. So there's a lot of different things that laser, and especially the research on laser, has just really expanded quite a bit over the last decade. They've gone from initially where it was all musculoskeletal to now they're doing a lot of work with lasers on neuropathies. One of the most interesting things that I've read recently, I'm going to actually talk about two things on this, is that there is a significant amount of research now on the treatment of things like nerve issues. A lot of people will develop like different types of nerve issues, whether it's a neuropathy from like a cervical issue or a lumbar issue or some chronic inflammatory conditions. And they found that in a lot of the research studies that there's over a 90% success rate with using class 4 lasers to heal neuropathies of most types. We see a lot of work that's being done now on things like laser for the brain. And they're using it for like brain performance enhancement. They're doing it for a lot of people who have stress and anxiety issues and major depressive disorders and seeing really miraculous results.
I understand. From what I understand, or from what I've researched, the biggest thing with lasers is it improves blood flow and therefore oxygen. What's the word I'm looking for? Oxygen exchange. Is that correct?
That is correct. Yeah, so the interesting mechanism about the way that laser works, which differentiates it from a lot of other things, is that when you shine the laser light over the tissues, it causes what's called vasodilation. It allows the blood vessels to expand. It increases the pace at which red blood cells are able to exchange oxygen and carbon dioxide. And for healing, the faster the tissue can get oxygen in and get CO2 out, it dramatically improves the ability of the body to process energy. There's a little powerhouse on each cell called the mitochondria. And each time that the laser goes over the mitochondria of a cell, it triples its metabolism. So each day that you have the laser applied, it essentially takes 1 day and it turns it into 3 days worth of healing time. So it's a really significant improvement in the pace at which a tissue can recover.
When I was researching about lasers, this number 3 came up quite often in many articles. So it can speed up the recovery by up to 3 times, 3x the recovery, right?
Yep.
So in my field, I own a gym. I'm a personal trainer. I have other trainers work there. In my field, there's a lot of like overuse injuries and tendinitis and stuff.
Right.
And from what I understand, laser is one of the safest and quickest ways to help with tendinitis, a fried tendon, so to speak.
Yeah. Well, let me give you a perfect example. When you get a tendinitis, right, you obviously have an inflammatory response because of overuse. But anytime you have any type of inflammatory process, blood supply goes down because the body now is dealing with edema. There's inflammation. There's all these byproducts of the injury. The body's having a difficult time because, maybe consistent overuse, not giving the tissue time to rest, whatever it might be. When the laser goes over that area, it instantly dilates the blood vessels. So the lymphatic channels, the blood vessels, everything that allows your body to get rid of the inflammation, and then it allows new blood flow to get in there, and it stimulates the body's ability to heal and recover the tissue much faster. Let me give you a perfect example. We had a young girl that came in last Thursday for her initial exam and treatment with the laser. And she's a tennis player, so she was dealing with a pretty significant issue with, traditional tennis elbow, so medial side of the elbow and the biceps tendon were very, very sore. She was getting a lot of pain when she would lift, when she'd swing, when she'd rotate. And she came in for a follow-up yesterday. And so her dad and her came in, and they said that her pain levels were down over 90% after just one treatment.
That sounds miraculously, like you said.
Yeah.
What kind of people cannot use the laser? What are the contraindications?
So good question. The great thing about it is there are very, very few contraindications. Number one, if somebody has an active cancer, The research is still a little undecided on the way that lasers affect cancer tissue. Some research is saying that it may be beneficial. Others are saying that it could accelerate the growth of the cancer tissue. So a relative contraindication is you avoid lasering anybody that has cancer.
Anybody or any area?
Because there's a possibility, if it's a metastatic cancer, the general rule, if it's metastatic, is you have to stay away from it, because if there's a tumor that's implanted in a tissue that's been undetected, you can accelerate its growth potentially.
Okay.
But that's something that I think the research in the next few years hopefully will weed out, is if it's an indication or contraindication for it. The other is if a person's on photosensitive medicines. So if someone shouldn't be out in direct sunlight because it may cause irritation in the tissues, then obviously you want to avoid that. And then a relative contraindication, but not an absolute, would be things like tattoos over the area. Because the ink in a tattoo could absorb some of the heat. Now, the way that you get around that is that you can still penetrate the tissue with a laser. You just have to keep it moving a little faster so the tissue doesn't have time to build up heat, because it is infrared. And so infrared lasers, they generate heat. So if you keep them static, then they will build up heat in the tissues and they could potentially cause a burn. If you keep them moving, then tissue heat does not build up and there's no tissue damage. I myself have tissue. I have tattoos on my arms, and so I've lasered over the tattoos, and as long as you keep it in motion, there's no real heat accumulation. But it's if it keeps static that it'll cause a problem.
But is it gonna have the same beneficial effect if you keep moving that fast?
It will. Yeah. Okay. Because the big thing with any kind of a laser, it's just being able to pass over the tissue with consistency. Because the way that the laser works is it's power over time. And so the way that the lasers have changed quite a bit over the last several years is they've dramatically upped the power in the lasers to be able to increase the treatment effectiveness, because it allows them to go deeper into tissues. So for example, if we were to turn the laser up, so the last laser that we had a maximum power of about 20 watts, which meant that if we were going over the spine, the laser would be able to penetrate to somewhere around the level of the actual joints in the vertebra, so give or take an inch or two deep. With the power that the laser's at now at 30 watts, you can get down to about the level of the spinal cord and a little bit past that. So if there's a disc issue, if there's some spinal cord inflammation, you can reach those areas. But it also allows you to get into deep tissues. Like we get people who will come in with things like abdominal strains, or some of the kids we take care of come in with constipation, and we'll laser the abdomen. It'll help to go and stimulate the bowel to start being able to relieve some of the constipation issues, deep muscle issues, hip issues, things like that. You can reach that with something with this kind of a power level.
Interesting. So some people that don't know anything about laser treatment or never experienced it might have a little bit of a skeptic fear, because hey, lasering my body? Like, what are the side effects? Are there side effects, and what are they? And don't hold back.
You know, the great thing is they're really, even in the research, there aren't negative side effects that are reported outside of some minor soreness in some people. And we've seen that consistently as we've gone through with this. If a person gets laser, at most, if they're going to experience anything, it's some minor soreness in the area when we've lasered it. And in most cases, that will happen if they're just a little dehydrated. But if you stay hydrated and you don't obviously push the tissues, then I've never seen a negative side effect other than that.
How long have you been doing this?
9 years.
9 years, okay.
9 years. So I've done thousands upon thousands upon thousands of lasers.
You even did one on me, which was interesting, because we did a little bit of my shoulder and stuff.
Yeah.
Long story, maybe for a different video, a different podcast. But you did have a little bit of a sinus infection, and you did my sinuses, and the next day they drained pretty well. I hope this is not too disgusting for the listeners, but it helped me a lot. I can actually sit and talk to you right now.
That's great.
So that helped a lot. And I have my own experience with tendon issues. I had a really bad patella tendon inflammation about 9-10 years ago, and I had laser treatment, and I was like, well, 10 years ago, I thought lasers, that's cool, right? So I had a little different mindset. So yeah, laser my knee. And it actually helped, like you said, like a miracle. I don't want to oversell it, but it does help. Yeah. It does help. What would you compare laser therapy to as far as effectiveness? Is there anything else in the medical field and the therapy field?
You know, that's a great question, because there are a lot of different technologies that are out there that are good therapeutics. I would say probably, laser is unique because it's diversity. There are other great technologies out there. Like one of the ones that I refer folks oftentimes to get things like soft wave therapy if there's something that, maybe would be better suited than a laser. I would say probably the most comparable would be like a soft wave. which is, if you guys aren't familiar with soft wave is a really cool technology as well. It's a local guy by the name of Mark Gronowski. He's one of the co-founders of a company called Softwave, where they use unfocused shock waves on tissues. And so we have people where we'll co-manage, where we'll actually have them go and get soft wave treatments, because what it helps is it'll go through, and over damaged tissue, it'll cause a reaction where it will ignite the production of stem cells locally to the area. And so we have people where we'll have them go out and get soft wave over the tissues, then have them come in and get laser. Because if you can create the production of stem cells, and then we can activate the tissues with a laser, you get a much bigger, more pronounced, faster result overall.
Understood. So my goal is just to provide information to the viewers on YouTube and the listeners on podcast platforms. By the way, subscribe to the channel. But my goal is to provide information, and I don't know if you're going to be comfortable with this question, but how expensive is it to get laser treatment?
That's a good question. You know, when you look at therapies that are out there on the market, the prices can be very broad. You know, if someone's looking to get stem cell treatments, for example, you can pay many thousands of dollars for stem cell treatments with not necessarily much of a promise of a result. It can be hit or miss with stem cells. You can get things like Softwave, and you know, I'm not going to go and necessarily speak to their cost, but those things, you know, you're talking greater than $100 in most cases for those treatments. With the cost of a standard laser treatment, it'll range somewhere between $50 and $75 per treatment, and it's based upon a region more than anything. So the larger the region, it'll typically be more around the $75 range. Smaller ranges, the price is typically going to be around.
So you said larger. How long does it treatment take? Like 5 minutes, 25 minutes?
Depends upon what you're doing. So let's say, for example, if you're doing like a large area like the low back, the treatment time typically is going to be somewhere in the 7 to 10 minute range.
Okay, so it's pretty fast.
Yeah.
How many treatments do you need to feel a difference?
It's a great question. With many people, they'll feel a difference within the first 24 hours.
After the first treatment?
Yeah. Some people get off the table and feel immediate changes, but I don't like to promise anything that it's not going to be a consistent result. I'll tell most people that you will notice changes within the first 24 hours, because the laser has about a 48-hour working window from the time of the initial dose that'll continue to work within the tissues. Depending upon the condition, the chronicity of the condition, the severity of the condition, the treatment time, expectation, frequency of visits is going to change. If you come in and you've got a chronic low back issue that's been something you've been dealing with for years, I will tell you that we're probably looking at anywhere from a month to a month and a half of treatment, which could be anywhere from 12 to 18 treatments. If you've come in and you've got a tendonitis that's a relatively new tendonitis, you could be looking at anywhere from 1 to 6 treatments.
I understand.
So it varies pretty widely.
I understand. And well, first of all, thank you so much for talking about this and educating the listeners and viewers on laser treatment. How can people find you, your practice? Right now we're in your clinic, which is, if you're watching on YouTube, you can see it's pretty colorful, because 50% or more of your patients are kids.
Yes.
You specialize on kids, but you also do their parents and adults and athletes and stuff.
Yeah.
But a big specialty on kids, which I think it's awesome. And,
thank you.
Where can people find you? What's the name of the clinic here?
So our practice name is Elite Family Chiropractic. We are all over social. Probably the easiest place to find us, we have a very active Facebook and Instagram presence. You can find us at facebook.com/EliteFamilyChiros. Same thing on Instagram. Our practice website is EliteFamilyChiros.com.
All right. Scott, thank you so much. And I hope if the listeners like it and share it and maybe get something out of this, maybe I can talk to you one day about something else.
I'd love that. Thank you so much for the opportunity to be on here to talk about laser therapy.
Of course. Thank you.
Thank you.
Stay sore, guys.